Hi everybody, I'm Dr. Carl Pesta from Michigan. I'd like to thank you for tuning in to this video on behalf of the American Society for Metabolic and Bariatric Surgery, community and private practice physicians. Today I want to talk to you about my practice in cosmetic surgery, which I've added on for my bariatric patients as well as the general public. I think the benefit of adding cosmetics to your practice is twofold. One is you get to work with your bariatric patients. You've already completely changed their lives, they love you for this, and now it's your ability to help them make that final transformation into the beautiful butterfly that they've been looking to become. And then second, of course, is the financial benefit. It's an opportunity to increase a revenue stream, basically, by performing these procedures. You don't have to give them away. So first of all, I'd like to talk about training. One organization I'd like to turn your attention to is the American Association of Cosmetic Surgery, or the AACS. Of course, they've got a website that will lead you to seminars and courses, webinars and that type of thing, where you can start to build your training. I had the opportunity to train side by side with a surgeon who had already been performing these procedures, so he helped me develop my practice as well. There's colleagues around the country who are willing to have you come shadow, which you could do with me as well. And starting out with the basic procedures, it's something that you can start right away. It's not neurosurgery. You should be able to take this on with the skills you've learned in your general surgery career as well. So that's plenty of opportunity. Some of the procedures I started with was the paniculectomy. Patients who have had their weight loss now, we use kind of like Medicare standards and apply them to other commercial insurances as well. And that usually is 100 pounds weight loss, stable weight for 6 months, and failure of medical treatment of prescription or over-the-counter medications for their intertrigo. So the insurance usually just covers the lower pannus removal. I've now added on liposuction and umbilical transposition to make it more of a cosmetic surgery for the patients if they so wish. And that allows me to add on a more cosmetic fee as well for that. I've also added brachioplasty, thigh lifts, liposuction, and even fat transfers to help patients assume the form that they would like to become. So you have the opportunity to learn those as well. When you look at locations as to where you perform this, I would recommend looking into surgery centers. Your colleagues locally have a connection with this most likely, and if you look around, you'll find them. And the reason I suggest this is because the credentialing may be a little bit easier for you. If you do this in a hospital setting, which I do as well, if you do have a robust plastic surgery department, they may give you a little bit of trouble as far as credentialing. So I find that if you go to a surgery center, you have the opportunity to use your credentials, talk with the medical director there, and show them your training, and you should be able to begin those procedures also. Some things you might need to build into that are cost, such as an anesthesiologist or a CRNA. In Michigan, we can supervise CRNAs, so I've found some CRNAs that I have the utmost confidence in, and I am then their supervising physician. So of course you'd have to check your local laws to see that this meets the standards for your area, but that has worked very well for me in that regard. Patients may ask, your bariatric patients may say, I didn't know you were a plastic surgeon. Because we know plastic surgeons require additional fellowship training, I'm very clear to say, well, no, I'm not a plastic surgeon. I'm additionally a cosmetic surgeon. And I tell them I've had additional training in cosmetics, and that puts them at ease as well. So I think with these things in mind, getting started on a cosmetic surgery practice will help expand your practice. It will help increase your revenue stream. And it's also some of my favorite cases to do in the OR. A lot less stress, and I've really enjoyed the benefits of this in my practice.